If your leg pain gets worse every time you do a back extension exercise, if McKenzie press-ups, standing back bends, or cobra stretches leave your legs feeling heavier, weaker, or more painful, you may be treating the wrong problem. And if this is the case, the exercises that you are doing could actually be making the symptoms worse. In this video, I am going to share and explain what happens, and I'll show you simple movements that may provide you a much better relief if your pain is coming from lumbar spinal stenosis. Plus, stay until the very end because I'm going to give you a bonus exercise that you can do before you even get out of bed in the morning. It just might make those first few steps less painful and much easier. Hi, I'm Dr. Chris Cameron, a chiropractor at Cameron Family Chiropractic right here in Lucan, Ontario. And for the last 25 years, I have helped people dealing with chronic back pain, sciatica, disc injuries, spinal stenosis, and leg pain to find non-surgical solutions and get back to doing what they love. Here's what most people don't realize. Not all leg pain is caused by the same problem. And that's where many people get stuck. If you have a disc bulge or a disc herniation, extension exercises often will be very helpful. That's why McKenzie exercises are so popular. But if your leg pain is coming from a lumbar spinal stenosis, that's the exact opposite. It'll cause more pain. Let me explain. Inside your lower back is a tunnel called the spinal canal. Your spinal nerves travel through that tunnel and their way down into the legs. Over time, things like arthritis, degeneration, bone spurs, and a thickening of the ligaments around the spine, they can cause that tunnel to narrow. That's what is known as spinal stenosis. Now here's the important part. When you arch backwards, that will make that tunnel even smaller. The joints compress, the ligaments buckle inwards, and pressure on the nerve increases, which means more leg pain, more numbness, more tingling, and a heavier feeling in the legs. But when you bend forward, the opposite happens. The canal opens, the joints separate, pressure on that nerve will decrease, and many people will experience relief. That's why so many people with spinal stenosis feel better leaning over a shopping cart while they're shopping, or sitting down from a standing position, or just simply bending slightly forward. Sound familiar? If standing and walking make your symptoms worse, but sitting or leaning forward helps, the next 3 exercises may be exactly what you've been looking for. Let's start with exercise number 1, seated forward flexion. This is one of the safest and easiest places to start. It's gentle, it's controlled, and it allows many people to experience immediate relief. Sit comfortably in a chair, place your feet flat on the floor. Slowly begin to bend forward, only as far as what feels comfortable for you. Relax your shoulders, relax your neck, and allow your lower back to gently round. Hold this for several seconds, then slowly return back up to that starting position sitting in a chair. Repeat this several times. In a lot of cases, many people notice a reduced pressure in the legs, less heaviness, and less pain. The reason? You're creating more space around that irritated nerve. Exercise number 2 is known as the standing countertop flexion. I love this one because you can do it almost anywhere. At home, at work, in the grocery store, even leaning over a shopping cart. Start by placing your hands on the countertop. Step back away from the countertop, then gently bend forward, flexing through your hips. Allow your lower back to relax, keep your knees slightly bent, and hold that position. If walking triggers your symptoms, this can be a great reset exercise throughout the day. Exercise number 3, the 90-90 relief position. This is one of my favorite positions for spinal stenosis patients, especially after they've been on their feet for a long day. Simply start by lying on your back. Place your lower legs on a chair, a couch, an ottoman. Your hips, your knees should both be roughly 90 degrees. That's why we call it the 90-90 position. Then simply relax. Let your lower back settle. Let your muscles unwind and simply breathe. Many patients will notice their leg pain begins to calm down within minutes. The heaviness decreases, the burning settles, and the pressure eases. This can be especially helpful before going to bed. Now for the bonus exercise. If the first few steps in the morning are painful, this one's for you. Before you stand up and get out of bed, simply lay in bed, lying on your back with your knees bent. Gently flatten your lower back into the mattress. Think about pulling your belly button slightly in towards your spine. Hold briefly. Then relax. That's it. No arching backwards, no rocking into extension, just enjoying that posterior tilt of the pelvis. This gently activates the deep stabilizing muscles of the lower back while placing the spine in a position that may reduce the nerve pressure before gravity is placed upon the spine for the entire day. For many people, this will allow the first few steps out of bed to be noticeably easier and more comfortable. If extension exercises consistently make your leg pain worse, please don't assume you're doing them incorrectly. You may simply have the wrong diagnosis. Disc problems and spinal stenosis are different conditions, and they often respond to different movements. Extension may help one and aggravate the other. That's why getting the right diagnosis matters, because the wrong exercise program can keep you stuck for months or even years. If you found this video helpful, make sure you hit subscribe to turn on notifications so you don't miss future videos on spinal stenosis, sciatica, disc injuries, and other non-surgical treatment options. And let me know in the comments, which one of these exercises gave you the most relief? Was it the seated forward flexion, the counter stretch, the 90-90 position? I'd love to hear from you. And if you want to learn more on our complete non-surgical strategy we use to deal with chronic lower back and leg pain, spinal stenosis, and sciatica, watch this next video. I put it down below. I'll walk you through the entire backstrong protocol and explain how we combine spinal decompression, laser therapy, chiropractic care, rehabilitation, stabilization into one structured system designed to help people avoid surgery whenever possible.